Hello, everyone. Welcome to the first ever episode of Savvy Sages. This is a video podcast aimed at promoting health and wellness. We started off, aiming more towards healthcare professionals and healthcare workers, but we realized that a lot of our goals and a lot of our discussions were universal. So we welcome everyone, all viewers and all listeners, to enjoy and join us on the journey. And just as an introduction, we have Dr. Anila from Chicago, and I'm Dr. Joseph from Toronto. And we are both medical doctors. We, primarily use science and medicine to help heal our patients, but we've also developed a healthy passion for education. And we've also developed a sense that, through empowering patients, through empowering ourselves, little life choices, little life lessons that we incorporate into daily life can uh, help us live our most fulfilled lives and have a greater sense of personal satisfaction, a greater quality of life. And that's where we want to focus our journey on when it comes to this series, little ways that we can focus on ourselves and grow. And I think it's important to recognize that we're all imperfect, we're all continually evolving, continually growing. And so our purpose here is just to have a discussion, to learn from each other, and to educate each other. Having said that, I think it's really important to point out that um, this podcast is not to deliver medical advice. If you do have any medical concerns, please talk to your own primary care physician who can best meet your needs. This podcast is purely for educational and discussion purposes. So thank you for joining us today. And without further ado, we have Dr. Anila introducing our first topic.
Yeah, thank you everyone for being here. We're really excited to be starting this podcast. And we're going to be talking today about boundaries. So let's go ahead and just dive right in. So Joe, I'm going to start out just asking you, what do you feel like is the definition of a boundary?
It's interesting because the way I usually view boundaries, or the way I think about it in my head, is almost something rigid, like a brick wall or a fence, almost like limitations, right? And setting up limitations around you. And I think it's important to recognize that sometimes we think about limitations and boundaries in a negative sense or a negative connotation, when in fact they can be very healthy, right? And as we'll discuss today, having those boundaries and limitations allows you to grow within yourself and grow in terms of your relationships with others. And I think we'll definitely dive more into that. What about you, Anila, Dr. Anila? How do you define boundaries, or how do you see boundaries?
Yeah, I completely agree with you, actually. So I have been involved in physician coaching, and that's one of the places where I've really thought a lot more about boundaries. And I really see it as a sort of protection that you have. It's something that you have around you that's going to help protect you, keep you safe. And actually, I think that with having more boundaries, it's something that allows you to then end up being able to form deeper relationships and honor yourself as well. So it's something that helps to kind of keep you safe.
Absolutely, absolutely. And maybe starting off on that note, why is this important, right? Why are boundaries important for yourself and for other people? What do you think, Dr. Anila?
Yeah, so boundaries are important for so many reasons. I keep finding that it seems to be the antidote to a lot of things that we have going on in life right now, including burnout. There's a lot of people who feel really, really burned out, and boundaries are one of the things that really helps with trying to prevent that burnout from happening. I've noticed that boundaries also help to reduce the amount of resentment. I've heard before that resentment is kind of like a cancer where it can metastasize quickly if you don't take care of it, and then it can lead to the detriment of whatever the situation or relationship is that you're trying to form. And boundaries are one of the things that helps to prevent that resentment from really setting in. And I think in general, it's also something that can help you really deepen your relationships when people are able to help make each other feel safe, and you're able to really understand each other's boundaries and how to honor them as well. What do you think?
Mm-hmm. Yeah, I mean, you touched on a really important word, the word safe, and that's where I come from as well in terms of safety, right? In multiple ways, in physical safety, emotional, and mental safety, right? Um, I find boundaries very important to me in my life because it does give me a sense of balance. Um, we, of course, live very, very busy lives. We're trying to do it all. That's the challenge of the 21st century, right? Trying to do it all, trying to have a social life, a great career, eat healthy, enjoy your life, and time is finite. We don't have unlimited hours in the day. And that's where boundaries come in. Boundaries allow me to organize my life. So, for example, maybe from 8 to 4, 8 to 5, I'll be in the clinic or in the hospital. Focused on what I need to do there. Focus on my responsibilities there to my patients and to my coworkers. And then, of course, afterwards, once all my responsibilities have been fulfilled, balancing out the rest of my day, right? So I may have a boundary between 6 to 7 in terms of going to the gym or exercising, another place, or meal prep or things like that, right? And then, for the rest of the day, I may, just relax, right? So again, it comes down to balance. It comes down to organizing. It allows me to prioritize, right? So of course, we can't necessarily cover everything in one day, but allowing me to prioritize what is most important to
Mhm.
me. And the way I like to think of it, there's different types of boundaries, right? So I kind of touched on time boundaries, but also emotional boundaries, right? Um, we touched earlier, in terms of how we think about it physically, but what about emotional boundaries? What do you think about that, Anila?
Yeah, I think emotional boundaries are incredibly important. And I think with emotional boundaries, one of the things, especially as physicians and in healthcare in general, I think one of the things that we often find is there's a lot of emotions that people come in with when they're trying to get care,
Mhm.
or with friends or with family. And oftentimes I think we're used to being people pleasers, and we often want to sort of become responsible for helping their emotions be more positive emotions rather than the negative ones. And that's a boundary I think we have to set with ourselves as well. So
Mhm.
boundaries are not only for other people, they're also for ourselves, and also setting boundaries for ourselves. And so that's a place where I know I've had to do some work, and I'm sure many of us in medicine, as well as outside of medicine, have had to do work that we know that the only person whose emotions we're truly responsible for are ourselves. We want to
Mhm.
show up in a way where we are potentially positive with other people, but at the same time we're not responsible for other people's emotions. And I think that that's a boundary, an emotional boundary, that ends up becoming really important too. How do you feel about that?
Yeah, absolutely. I think starting within yourself, right, and understanding your own limitations, your own boundaries, and sometimes that can be hard, especially if you have a very type A personality, maybe very ambitious. But it's a healthy place to start. It's healthy to understand where your own personal boundaries are in terms of your time and in terms of your energy, because um, as you mentioned, that allows you to, once you identify your own boundaries, you can express those boundaries to other people, right? So absolutely, and that extends beyond the physician patient relationship, but even to your personal life, whether it be your family, your friends, romantic partners. Ultimately, having that sense that you can only do so much, right? At the end of the day, you do your best in terms of putting your best foot forward into the world, whether it be your career or otherwise, and understanding that the way other people may perceive that differs on the person. Some people will really appreciate your efforts or what you do. Some people may not, and that's perfectly fine, right? Um, Naturally, being in a field where caregiving is so important, we tend to have that mentality of we want to please people. That's something that I've fallen into many times, where it's hard for me to say no, right? But it's healthy to say no. It's healthy to create that boundary and understand that in certain situations, no is necessary uh, in your best interest and in the best interest of the other individual as well. Even if it may be necessarily hard to hear, like you mentioned, each individual is responsible for the way they feel, right? And ultimately, the healthiest relationships are the ones that respect those boundaries and have the maturity to abide by them, right? And that's something that is continually evolving and continually growing
Yeah.
as you continue to move forward in various relationships. Right?
Yeah. Yeah, and I think that also there's that's where part of the reason why that's such an important aspect as well is because if we don't allow people to have their own emotions, then it becomes more of a
Mhm.
script where we feel like they have to be a certain way, they have to feel a certain way, they have to do certain things. I think one of the things that boundaries are not are scripts. This is also something I've learned through my own coaching. Is a script is how a person should show up, how they should feel, how they should think, how they should act. which is very different than a boundary, which is meant to be protective of ourselves. And I think sometimes people figure that boundaries are the same thing as a script, which they're not necessarily. When we start to people please a lot, then we sort of are attached to the idea that this person, now that we've done all this stuff for this person, they should feel a certain way. And then when they don't feel that way, we sometimes can have other emotions that go along with that. And I think disconnecting from that is important. So support is important, and being able to be there for the person is important, but not necessarily in a way where you feel like you are responsible for changing their emotion. That's where our own boundaries end up becoming important, that we're not expecting them to be different than who they are, and we're accepting them.
Right. Absolutely. And I think that's important to recognize, because your boundaries will in many ways be influenced by the people around you and the environment around you. And I think it's important to adjust accordingly. Absolutely. Fantastic. So I think we've touched on, in terms of time boundaries and emotional boundaries, how do we go about establishing those boundaries?
Yeah. So probably the first most important thing is getting really clear on what the boundary is. This also goes into looking at the spectrum to make sure it's not an expectation or a preference, but truly a boundary. Once you can get really, really clear on what that boundary is, then I think the next step is being able to learn how to communicate that boundary. If we just know it, but we can't communicate it to others, it's never really going to be helpful enough, because we can't expect people to mind read. So it's going to be being very clear, being able to communicate it, and then following through. So if you say you're going to do a certain something, if someone continues to push that boundary, then you're going to do X, Y, and Z, and you have to make sure you actually do X, Y, and Z each time that boundary is violated. Otherwise, it's not going to be fruitful either. So I'd say getting clear, being able to communicate it, and then following through.
Absolutely. I think communication is absolutely key, right? And I think communication is everything in so many ways, right? Knowing what your boundary is and communicating it in a very respectful manner and a clear manner is the best way of establishing that. And I think consistency and persistence matter, right? I think we tend to have a tendency of, maybe letting our boundaries come down a bit every so often, and that can create confusion with people, right? So I think, like you mentioned, the clarity is important. I think the consistency is also important, because, again, we're social creatures. We learn through habit, and we see patterns, right? And if we understand that, hey, this is a particular boundary that this person has. So, for example, perhaps you might have a friend and they don't want to come out after 11 p.m. If that's consistent, you tend to internalize it and understand that, right? And you understand that's really important, right? So I think consistency is very, very important in terms of establishing those boundaries, right? What do you think, Dr. Anila?
Yeah, absolutely. I think consistency is really important. And I think that boundaries are fluid. So, your boundaries might be very different in the beginning when you're just starting out a relationship than they are if you've known the person for 20 years. You might feel very uncomfortable with a new person, touching you or hugging you. Maybe when you've known them for 20 years, those walls start to change a little bit. Your boundaries start to change, and now hugs are completely appropriate and normal. So it is a fluid thing as well. And I think one of the things that happens oftentimes is that we try things out, especially when we're first learning how to set boundaries well. I think we can try things out, and sometimes it doesn't quite feel right. Maybe that boundary wasn't really a true boundary for you, or maybe you were too rigid. And I think that's okay too. We try things, we learn that it's not exactly right, and then we can keep honing it until we get to a place where it does feel really clear for us.
Yeah, absolutely. I think you hit on a couple of really, really important points. I like the way you described it as something fluid, right? As opposed to like rigid, right? Because you're right. As situations develop, whether it be the patient-physician relationship, friend relationship, romantic relationship, things will naturally evolve. And I think it's healthy to have those boundaries up initially until you get to a point that you feel comfortable, right? Once you get to a point where you feel as though that particular relationship has set a certain point, um, those boundaries can change. So just as with anything else in your life, I think these things are continually evolving, and it will require to continue to adapt. So you mentioned an example of like a romantic partner, right? Initially, of course, you're going to be fairly well guarded because you don't really know the individual. As you get to know them, some of those boundaries change, absolutely. And I guess my example would be from more of the professional setting, even just knowing some of your colleagues, right? Whether it be other doctors, nurses, MAs, whatever it may be. As you get to understand people, as you get to know people, your boundaries can evolve, right? Certain boundaries will continue to stay rigid no matter what, because ultimately that's important to you, for sure. But it's also important to keep in mind that certain boundaries will continue to evolve, and that's perfectly fine. That's the process, right? And sometimes changing those boundaries will lead to good results. Sometimes it won't, and that's something I think we want to keep in mind as well. That continual learning from your mistakes, learning from experiences, not just the mistakes, but what also kind of went well, right? Um, how do you feel about recognizing the signs of when your boundary has been uh, ignored or impeded?
Yeah. I think that we all have kind of a feeling when we know that a boundary has sort of been overstepped. We sort of feel just icky, like we don't feel good. Sometimes we might actually feel truly unsafe. Sometimes we just feel a little violated, but there's always a little some feeling that's there. And I think it's about recognizing it and being willing to acknowledge it, and then being willing to say, okay, what was it about this interaction that ended up making me feel that way, and kind of pinpointing specifically what it was. That's where I think you get clear again. But I think we all kind of have a feeling of when it doesn't feel right. What do you think? How do you felt with that?
Yeah, absolutely. I think we all have that personal intuition that something's wrong, right? And I think especially now in the 21st century, over the last few years, we've seen a significant culture change where I think there's been a greater emphasis on personal security and safety, personal autonomy, self-respect, mutual respect, and mental well-being. And it really is time that we have that conversation for sure. I think we grew up thinking, or we grew up with this idea that, oh, certain boundaries are there, but you're supposed to be open to every situation and everyone, and that can be dangerous, right? We've seen over the last few years significant issues when it comes to workplace harassment, whether it be emotional or physical. These are important topics. These are important things to to keep in mind and to think about. So I think it's important to kind of recognize that and start that conversation now, right? And basically, like we talked about earlier, be open, communicate, discuss what you feel comfortable with, discuss what you don't feel comfortable with. Now, of course, the question comes up: what happens if someone doesn't feel comfortable with your boundary? Like, how do you handle that situation?
Yeah, I think it's probably initially, um, first of all, recognizing it is important, and being okay and being able to acknowledge for yourself that it's okay that you have this boundary that you don't like, or that you
Mhm.
don't want someone else to do something different. I think it's important to know, they always teach in coaching that when you set a boundary, you want it to come from a good place, not from like an angry,
Mhm.
resentful, frustrated place. So kind of being able to
Mhm.
think about those boundaries ahead of time is especially important, because then you really know that you're honoring yourself, and you're going to stay, you're going to stay put in the fact that you do deserve this, because all of us, everyone deserves love, everyone deserves respect, everyone deserves to be treated well. And so being able to acknowledge that for yourself is also really important. So once I think you recognize that this is a boundary that is being, that someone is continuously overstepping, then I think the next thing is communicating it with them. And then it does become a really difficult thing. Is it going to be that the person is not, you're going to distance yourself from the person? Is there room for the person to be able to really be willing to be on board? I mean, the truth is, all of us are also going to overstep other people's boundaries at one point or another. It's just human nature. And sometimes I think it's about how important that relationship is in terms of whether or not you're able to find a way to respect each other's boundaries. And then I think the other thing to also ask is this an actual boundary or a preference? So I have a friend, for example, who is always late. And I'm not particularly good at being on time either, but she's 30 to 45 minutes late every single time we hang out. And I've known her for 25 years. And so for a while, it was frustrating to me that she would be late. And I talked to her about it, but it continued to be an issue. For some people, being late is an absolute deal breaker. For them, it's a very strong boundary. For me, it isn't.
Mhm.
It was kind of an annoyance, but it wasn't something that I wanted to lose the relationship over. And eventually I figured out that if I just tell her we're meeting 30 minutes earlier than when I show up, it helps to sort of resolve it, because I would tell her let's meet at 3:30, and or I would tell her let's meet at 3, and really I would show up at 3:30, And for me, you know, it sort of actually just allowed us to continue our friendship without it becoming this huge source of tension. Some might say that that's something where I let go of a boundary, but I think for me, it wasn't a true boundary. If it was something that was making me feel truly unsafe, then I think if someone continues to overstep it, we do have to consider whether it's worth it to distance ourselves from that relationship or let go of the relationship completely. How about you? Have you experienced with this?
Yeah, yeah, absolutely. Again, it comes down to the purpose of the boundary, right? The purpose of the boundary is safety, right? Absolutely. And ultimately, I think it's important for each one of us to have the confidence to say, my boundaries are important to me. And if someone steps over that boundary, like you said, explaining, making sure that they're aware of it, right? Ultimately, like we discussed before, everyone's got a choice. All individuals have a choice whether to respect the boundary or not. Some people will. And it's interesting that how you turn the tables at one point talking about us, right? How we ourselves, we will oftentimes, um, we overstep certain boundaries without even knowing it. And again, it comes down to the maturity of the individual, right? Having the maturity to understand and say, you know what, this is important to this person. We may not necessarily agree with it. We may think, oh, that's a little weird. But then again, it's not up to us to define other people's boundaries for them. It's up to us to respect them, right? And as you mentioned before, if we can respect other people's boundaries, other people should respect our boundaries. And people who cannot respect your boundaries, no problem, nothing personal. But unless action is taken, that's going to strain the relationship. Absolutely. And again, having the confidence to enforce those boundaries and not be overlooked and not be ignored is really, really important because, as we mentioned earlier, that's a sign of self-love. It's a sign of self-respect. Absolutely. And I feel like, as you mentioned, the quality of your relationships, the quality of your encounters, both at work and outside of work, will definitely improve when you're with people and you're interacting with people who understand and value those boundaries because you value theirs as well. It's back and forth.
Yes.
Right?
Yeah.
What do you think?
Absolutely. And there's another something that I've been kind of trying to understand a little bit more in coaching. And by the way, I just want to mention that Joe and I are talking about a lot of this stuff today, but it's not because we think we're great at this and perfect at this. This is, we're growing really with everyone. And so it's a practice for us as well. So it's not that we have all the answers, but it's something that we just felt like was really important to talk about. But one thing I've learned through my own coaching has also been this concept of unconditional love. I don't know if I have believed in total unconditional love for a long time, but the way they explain it and the way I'm coming to learn it a little bit more makes sense to me. And the idea of unconditional love is that you can love someone without sort of accepting them where they're at and not having a script for how they should act or need to feel. So I had a situation a few weeks ago where that's something I decided for myself is this is someone that I'm going to be interacting with and I really love. And so I kept asking myself throughout the whole day, what would I do how would I show up if I loved this person, regardless of how they thought? And really it's what we think they're thinking, right? It's what we think they're feeling, regardless of how they're thinking, feeling, acting. If I really love this person, how would I show up? And then the caveat to that ends up being a boundary. That doesn't mean that you have to tolerate someone's disrespect or someone's really poor behavior if it's making you feel unsafe. That's where your boundaries end up becoming really important because you can unconditionally love others, but you also have to love yourself. And so that's where if somebody oversteps that boundary, then you can really enforce it and say, this part isn't okay. Like I can love you, but I'm going to take my own distance if you have to, or, anything of that sort. So I think that amalgamation of knowing that you have your own back, so to speak, with boundaries helps you then be able to get into deeper relationships and trust others.
Absolutely. I agree 100%. That 100%. That sense of self-love is essential. And again, I think we continually try to drive home that point that having those boundaries and reinforcing them are significant signs of self-love. And again, it allows you to grow within. And we're talking a lot about interpersonal relationships as well, right? Professionally and otherwise. But even personally, when you reinforce what's most important to you, what matters to you, that is incredibly empowering, right? And that's something I think we talk about with our friends, with other physicians, with patience, that sense of self-empowerment, right? Fighting for what's important to you and what works best for you and what allows you to grow and help and ultimately feel healthy is so important. And that's where, and that's part of the reason why we start with boundaries, right? Because we want to look inward and ultimately um, grow within those boundaries because they foster further growth with us, right? I think I saw one kind of example of like, for example, certain plants and trees. So like the name of our podcast is Savvy Sages, right? Partly after the sage plant, but certain plants, if you basically plant them in a pot, they're quite healthy. They grow well because oftentimes they're able to build strong roots within the pot and have certain amounts of nutrients. Whereas I think certain other plants don't do as well in the wild because they tend to grow fairly, like their roots go fairly far, and I guess they don't grow as tall or as rich. So I just thought that was an interesting um, basically thought and comparison to what we're talking about today in terms of just growing. So when you think about the plant, it has that plant, that little pot to help it foster growth. In the same way, I think we can see barriers in our own lives doing the same thing, right? Allowing us to be protected from various, dangers on the outside, various elements, and allowing us to further grow within ourselves and through each other, ultimately,
Yeah.
right?
Yeah, there's actually
What do you think,
some
Anila?
information about how if you can't exert your own boundaries, if we have trouble with our own, we're going to have a much harder time
Mhm.
with being able to respect other people's. Maybe it comes from the idea that if we don't know how to feel safe and be able to speak for how we are going to be able to feel safe, then you're almost on guard for the idea that maybe someone else is going to make you feel unsafe because you're not going to sort of have your back. So I think one of the most important things too is as we learn to be better about asserting boundaries, we'll be able to respect other people's boundaries more. And then once you can feel safer in a relationship overall, I think that's one of the only ways that you can grow. I mean, whether it's with patients, right? The more they
Mhm.
trust you, the more safer they feel with you, the more they want to lean into what you're talking about and be able to do the things that you're doing. So I think boundaries really does become a very important part of any interaction that you have with people.
Absolutely, absolutely. And I mean, ultimately, like we discussed earlier, there's so many different forms of boundaries: time, energy, physical boundaries, of course, right? Emotional boundaries and mental boundaries. And ultimately, we're all on this journey in terms of developing different techniques and different ways of growing those boundaries for sure. Um, it's an interesting topic and it's such a complex topic. But ultimately, what we wanted to do was get the conversation started, right? And talk to our viewers, talk to the audience about how they feel about boundaries. Um, so I guess I mean it's a complex subject, but we can give I guess a quick summary in terms of what we feel about in terms of boundaries and what we've learned in terms of boundaries. And I guess I'll start in terms of what I would love to like my take home points is boundaries are essential. Boundaries are healthy and boundaries are there for your safety, right? Embrace them. Don't see them as limitations. See them as ways of continuing to foster growth within you, right? Yeah.
Yeah, boundaries are they're going to help. They're going to help the most with preventing you from becoming burned out or trying to reduce the amount of burnout. They're going to help deepen relationships. They're going to help you trust yourself more, as well as trust
Mhm.
others more. Help lead a more balanced life, like you were talking about earlier, Joe. So boundaries have a lot of. They'll help to reduce the amount of potential resentment that sets in relationships. So really, really important stuff.
Absolutely. And the key here is continued practice, right? Continue practicing just as you practice the piano, just as you practice playing basketball, practicing establishing boundaries for yourself and for others, maintaining them and allowing them to evolve will ultimately yield to better results and yield better growth, right?
Yeah, yeah.
Um,
Trying to, and just even in terms of practice, you might find that sometimes your boundary was a little too wishy-washy. That's okay.
mhm,
You hone it. You might find that your boundary was too rigid, and then you hone it some more. So it's playing around with it until it feels kind of right, where you don't feel like it's too much or too little. And the key is still, I believe, anyways, are recognizing it, becoming really clear on it, being able to communicate it, and then following through consistently. So maybe clarity, communication and consistency, if we went with 3 C's.
There you go. There are the 3 C's. Absolutely. I love it. Clarity, consistency, and communication, right? Fantastic. I think we covered quite a lot today, but it is a very broad topic. And again, as we mentioned earlier, this is all about discussion. It's all about growing together, right? And learning from each other. And we'd love to hear from you as well. So please feel free to leave a comment. We will be on Instagram, Facebook, and YouTube. Please be kind, please be respectful, and please be professional. Um, and we will be also having a live Zoom chat with anyone who wants to discuss with us, whether healthcare professionals, healthcare workers, or otherwise, in terms of what boundaries mean to them, maybe some of their own experiences with boundaries, and basically foster a place where we can continue to grow together, right? So thank you for joining us today. It's our first episode, so there's a lot of learning, but we hope that you'll stay with us on this journey and continue to grow with us. And ultimately, just to give you a quick preview of our next episode will be discussing a very sensitive topic, but a very necessary topic, and it's the art of letting go. And when we think of letting go, it's often in different forms. We let go of maybe a relationship, a friendship, letting go of maybe patience, letting go of maybe certain ideas or opportunities, and basically learning to come to grips with it, how to move forward with life, how to appreciate what was, and letting go of what happened. So we hope you enjoy today's episode, and we hope to hear you and hope you join us for the next episode. But from Dr. Anila and myself, thanks for joining us today. We wish you all the best. Please stay safe. Please prioritize your own health and well-being. Be kind to each other. We hope you continue to grow with us. And always remember that your best is yet to come if you choose it. All the best, and we hope to talk to you again. Take care.
Thank you, everyone. Bye-bye.